Yes, sir, we can start.
Okay. Good evening, everyone. Chairman, Indian School of Urology, Professor Rajiv Sood, and Co-Chairman, Indian School of Urology, Dr. Arun Chawla. Dear residents, MCH and DNB residents. Today we are having an upcoming and an important topic, men's health, which is going to be included in the curriculum for the urology training. It is already there in the other parts of the world, but in our country still it is not fully incorporated into the thing. So men's health is a very important thing, and has been something which has been ignored for a long time. But now the Urological Society of India has taken initiative, and even we have globally a men's health forum as well, Men's Health Society, for the upliftment and care of the men's health problems. So men's health problems can be a variety of things incorporated in it, but we ourselves do ignore the men's health issues. So this will be one of an important arena in the years to come. Now we have today to discuss and deliberate upon this men's health issues. We have none other than Professor Rajiv Sood, who is the chairman of the Indian School of Urology and who is in the forefront for propagating the men's health. And he is a founder and a very important person internationally in the Men's Health Society. With these few words, I welcome you all today to this virtual class on men's health. Now I would request Professor Rajiv Sood, Chairman, Indian School of Urology, to take over the further proceedings. Over to you, sir.
Thank you, Dr. Rajiv, and welcome to all the students who have joined and also the faculty who have joined. Today, we are going to deliberate on very important topic, which has been now part of your textbook in 11th and 12th Campbell editions. It is the part, it is something new. It can come to your exams also as the new topic. It is very, very important for your clinical practice also. And I'll deliberate on all of this one by one, and you will see that why it is important and why we are stressing on men's health, because it is integrated specialty. Can you see my slides?
It's a tush, yeah, now it's okay.
Sorry. It is there?
No, sir, we are seeing the, I think the last slide, 163 slide number.
Oh, sorry.
Thank you, slide. You can make it to start from the beginning. Yeah, slideshow from the beginning.
Yeah.
Then it's easy.
Now it is fine? No.
No, this
No,
is
sir.
a thank you slide again.
Why it is coming thank you slide?
You have to go back, sir.
Yeah, I am going back and just a minute. Give me 1 second only and I'll set it right. Okay,
Yeah.
now you can see.
Yeah. Now we have to zoom up, sir. You have to the full slideshow. Yeah, now it is okay.
It is okay. Okay. So we are talking about men's health, which is an integrated specialty, and who is leading it? It is the urologist who is leading it, and it is given in your Campbell textbook also. Finally, we are into it for last 1.5 decades, and we had our global conference also in India, where we are in the way to write the men's health report for India also, as it has been written for Malaysia in Asia and USA, UK and some other countries. So, being the president of Men's Health Society of India and also representing as member the Standing Committee for Initiative of Sexual Health in Indian Medical Association, I have the proud privilege to be associated with this right from the beginning. You see on the left lower portion, there is the general medical practice, and in overall practice, men's health is the important part of that practice. And there is in the society rapid urbanization and rapid aging also. And what is happening? Both are important for men's health. In the urbanization as well as in rapid aging, what is happening? If any country has more than 7% of the population more than 60 years, that is called aging nation, and India is 8.5. So we keep on talking that India is still not the aging nation, but it has already become the aging nation. And percentage of population more than 60 in 2050 will be many-fold more, and India is not going to be far behind. And India will become the grey nation, or already becoming grey nation before it is becoming a rich nation. And in all this scenario, why men's health is neglected till date? You see that you must have heard about maternal child programs, infectious diseases, non-infectious diseases, reproductive health, maternal health. But have you seen any national program dedicated for men's health or related reproductive health? If you apply your mind, we have no such national health program. There were new initiative programs started, and in new initiatives started, it is on cancer, it is on diabetes, it is on hypertension, other so many things have come in new initiative. They are in addition to the national health programs. Those who are interested in the social preventive medicine, they know it, but there is no program dedicated for men's health. So what is the fact that in all new initiative programs which are related to the metabolic diseases, men is in the center of that. And what is happening, the real Vitruvian man had a different structure, and now the metabolically diseased man has totally different modern day Vitruvian men. Older perspective of men's health was that men's health is only sexual health and sexual medicine, and till 200 years back, it was the only health, the sexual health was the only men's health. Whether Ayurveda, Arabic medicine, Chinese medicine, you go to any kind of medicine in the last millennium, it was always men's health. And 200 years back, there was the agitations for women's rights, and there were books like Know Your Body, and they were allowed to talk about their health. So they became very aggressive, and all the governments all over the world, they become very aggressively dedicated for the new program, because women was socially backward. But we forgot that men is physically more vulnerable, more diseases are there, and the lifespan is shorter. And there was poor collection of data. 200 years, last 200 years, men's health had severe setback. So why now, after 200 years, sudden interest is that global ratio at the birth is 107 male to 100 female. And if you go to conceptions, there are much more conceptions, but you must have seen and you must have heard that spontaneous abortions are male child more, stillbirths are male child more, and the termination of pregnancies, they are natural termination of pregnancies more of male. And therefore, ultimately, when the male keeps on growing, females keeps on growing, more and more males proportionately die. And in the old age, maybe 85 and above of age, there is a ratio reversed totally, and very bad ratio is there, 8 female to 1 male. So this is the plight of male in the aging population which the India is becoming. So this is a story of 3 millenniums. One was the millennium when men's health dominated. Second millennium, we lived till year 2000. And after 2000, we have entered the future millennium. And that millennium is the millennium which we are talking about. Men's health in the past was in all the systems, Ayurvedic to Chinese, I told you that that was men was the main focus, and in men also, the sexual health was the main focus. But the things are changing, and now India is aging, and I have told you in the old age, there are more widows, there are more socially dependent female population. There is totally feminization of the aging. And this is the effect, because men is suffering more physically and dying early. And it is becoming feminized aging population in India. There are nearly 104 million elderly persons in India, and 53 million females and 51 million males. Both the share and size of elderly population is increasing, I have told you, and there is a feminization going on, and the consequences are, there are medical consequences, the GDP will go down, the productive population is going down, and ironically, there is a scarce data available for about the health status of the aged persons. Now, why it is happening? Now you see structurally, if you look at the brain, this is the picture which is there. The blue areas are the areas which are dominant or larger in female, and these the blue are larger in females, and blue are pink are larger in female, and blue are larger in male. And in the homo population, lesbians, this is the structure is totally different. So there are anatomical reasons, there are physiological reasons, the hormones are different, that there are different areas dominated, like incidence of aphasia is more in the anterior brain for the women and posterior brain in the male. So this is the structural and functional difference, and when it interact with the hormones released by males and females different, and the environmental influences and the socio-cultural influences, the different persona is developed, and there are sex differences in the male and
goggles too.
the possible causes of sex differences are therefore physical structure, hormonal structures, and environmental influences. Now coming to longevity, there are only 2 countries in the world where Qatar, where male is living 2 years more, or Kuwait, where it is equal. But in Russia, the male is dying 12 years earlier than women. There are other countries like global life expectancy, there is a difference of 5 years. Men is dying early. In Europe, it is 7 years they are dying early. And in India, the difference has been maintained at 3 years. Yes, this is also true that the blacks are dying earlier. Females are living more, and white females have the maximum lifespan. And also, this is also a fact that larger stature races, they live shorter, and shorter races are living for longer time. And also because male is larger in comparison to female, therefore male is also on that logic dying early. And these are the different countries, the regions: Canada, North America, Sub-Saharan Africa, and Russian Federation. Everywhere longevity is increasing, but the difference between male and female longevity is maintained or is widening. And it is, I told you that the worse in Russia, where men is dying 12 years earlier. What are the reasons now? We have understood that this is happening, but there is increased genetic susceptibility. Yes, and I'll come to that. Stress of being provider of the family. So mental stress, mental health, that also plays role. And also increase in the metabolic syndrome component, CAD, stress, metabolic syndrome, depression associated with risk factors, because high risk jobs are taken by men. They are more dying in the workplace. In the workplace, deaths are 90% males. Wartime deaths are there. Road traffic deaths are there. All are dominated by male. And the unique diseases also, like cancers, they are more in male. And the cancer, after cancer treatment, the response is also poorer compared to female in the male. So there are many unrecognized factors, and but one thing is sure, men die early and suffer more. So genetic basis, we will go to the sex chromosomes, and X chromosome and Y chromosome has difference, and the Y chromosome has 3 to 6 time mutations, which is in the male. And if there is anything happening in male to the X chromosome, the fetus will not survive. So double X in female is luxury, and a single X is very important in male hormone pair, this chromosome pair, because if something happens to X chromosome, patient will not survive. X0 can survive, but Y0 cannot survive. So this is important. And there are 3,000 genes on X chromosome, but only 50 on Y. What is happening? Y chromosome is becoming shorter and shorter with time, and it is also estimated in another 100 million years it may disappear. When after conception, in the first 6 years of conception, there is no morphological morpho-gender differentiation, and that starts after 6 weeks. So it will not finish the differentiation between male and female, and maybe it is lasting, and only at reproductive age it will start happening. That is the story which is going to be uncovered. There are any reasons now?
What happened, sir?
I think I was disconnected somehow.
Okay.
I don't know why.
No, you can share again, sir.
Now you can listen to me.
Yeah, I can, but I am not seeing your presentation.
Yeah, it has all gone. I don't know what happened. The net got disconnected.
Sir, again, it will come back to the same page then.
Yeah, it is coming?
No, not yet, sir.
It is not coming. Okay, just a minute. I don't know what happened. It never happens like that.
Sir, you can go to share screen again.
It is coming?
Yeah. It will come, sir.
It has come now?
No. It is showing. Yeah. We are there now, sir.
So there is the current status of men's health. The report of out of touch American man on healthcare system, need for expanded efforts to address men's health, and also need of special male oriented clinics. This has been now appreciated. And this is very important last thing, that there is need of special male oriented clinics, and these clinics have been slated to be led by urologists. Men is weaker since inception. I have already explained to you, because of the XY chromosome, weaker immunity in the men compared to female, and also there is they are more vulnerable to long-term neurological and motor impairments after preterm birth, because preterm birth is also more in male. So what is now men's health? It is integrated specialty. It will include, of course, urology is going to lead it, but it will include cardiovascular, endocrine, psychiatry, andrology, gerontology, preventive health, and change in the social perspective, that is sociology. So it is the integrated specialization, or you can say, like from MBBS we go for specialization and then super specialization. It is the back integration of the specialties, and in this the urologist is mainly leading, but even family physician can lead. Why a lack of specialty till date related to men's health? Because women health everybody talks. Lack of awareness, lack of conferences, lack of books, lack of medical journals, reviews on and also men's health topics in the curriculum and also in the conferences. And this is very important to address various issues, and therefore there is a need of integrated men's health clinic, because between 2000 and 2050, proportion of persons over 65 years of age is expected to be more than double. That is from 6.9%, which was there. I have told you it is already increasing, and it will go to 16.4%. And therefore, male to female ratio in the centenarians, those who will outlive 100 years of life, it will be 1:4. So there are importance of impact of sex. Sex has a huge impact. Every cell has a sex. I told you XY chromosomes. Study of the sex differences we have studied, that is also important. And barriers to the advancement of the knowledge about sex differences must be curbed. Many diseases like urinary incontinence are more often silent in men. Men may be bound by social role and norms. Men less likely to receive active treatment for urinary infections. And also it has been found that they are prone to the other developmental disorders. There is reading delays, deafness, autism, which is very famous, and some movie was also made on that. That is 3 to 4 times in male. And Asperger's syndrome is a mild form of autism, hyperactivity, and that is 10 times in male child. So there is also differences in the life cycle. Men invest more in their sources. They go to the bodybuilding clubs and they burn out their calories, and stem cells also. They burn out faster. It should be moderate exercise and not too much exercise and six pack and all. When we concentrate, that is, we are burning our stem cells faster. Women are geared for endurance in life, and typically they are shorter. I told you that also increase their life, and smaller. And men older than 50 to 60 years are not socially active, and women still have a role as care givers in the family for long, and they are more social. They are not loners, and mostly the street children are also males. The death rates in the selected diseases, whether they are infectious diseases or they are non-infectious diseases or even cancer, it is much more in male compared to female. You see, if we concentrate, most important today is the cancer. Here the male to female occurrence is 225.1 to 155.6 per lakh per year. Cardiovascular burden, you see the male is in the blue and female is in the pink bars, And you see that cardiovascular burden almost everywhere, it is more in male, and also hypertension more in males, and also the higher risk of CAD, CVD, triple vessel disease, all is more in male, and risks are likely to be greater in men living in the single households. Cancer, it is the one killer which is increasing very fast. Like prostate cancer, we are concerned, prostate cancer is increasing by 210% per year with this rate, and it is only second to the lung cancer in increasing the incidence. And therefore it is very important to concentrate that why more men than women are suffering from cancer. And this advantage of women suffering from cancer, however, decrease with advancing age, and the differential knowledge of gender is important. Male specific cancers are important, and prostate cancer, which was in the 1996 survey, it was in India at 7th to 10th slot, other than the places where the urbanization was there in Barchi and all, which were the rural areas, it was not that prominent there. But now it has become, at least in Delhi and Bangalore and other metros, like in Delhi, it has come to number 2 slot, and it is going to be at number 1 slot. So this is important for the urologist. And the prostate cancer, this is 2005 table, but now it is much more problematic. Urinary bladder, kidney, and prostate in male all have come in the top 10 cancers. And there are demographic changes in the aging society. I have already told, this is in the metros, showing that the prostate cancer is increasing. And like advanced countries like USA, UK, it will become number 1 male cancer in very short time. There are now in men germline factors, smoking, tobacco, alcohol use, it is all more than female. And also diet, the more fatty diet, more rich diet is taken by male. Overweight and obesity is more in male. Metabolic syndrome is more in male. The physical inactivity is there. Urban air pollution is there, which is affecting male more. And there are many other factors. So diabetes, you see the blue bars are going from pink bars, and male is suffering more in male in India. And also metabolic syndrome associations are more in male, and abdominal obesity is also more in male. Adipose tissue is also more in male. Dangerous occupations I have already discussed, and latest Campbell says, and many other studies says that at workplace, the occupation related deaths are 90 to 95% in males. Men are more susceptible to suicide because of the mental health, we have told you, and 3 to 4 times more suicidal deaths are in males. And in the medical community also, in the medicos also, when death is many folds increase, the suicidal deaths, it is also more dominated by male suicidal deaths. Alcohol consumption, it is more in male. Substance abuse, and also there is tobacco use and other problems, they are more in male, and related ailments are also more in male. And that is the reason obesity, substance abuse, that Russia-like countries, European countries, the male is dying much earlier than even India. There are sex-based differences in even infectious diseases, whether it is in the infants, in the elderly. The males have naturally weaker immune system in infants, and therefore they are suffering more. In corona times also, males are suffering more. It is around estimated 69 to 80% in different studies. The corona is affecting male more, and the outcomes are corona deaths are also more in male. HIV also more in male, even hepatitis B and C, they are also more in male. And there is a lot of thinking that why even infectious diseases are more in male. There are two reasons. One is the immune system problems, and the second is the hormones. Actually hypothesized that menarche to menopause, this is the time when female hormones save female from all these infections. So epidemics are prone areas, endemic, epidemic, and pandemics. They are more in males, diarrheal disease, even respiratory infection, and even neonatal tetanus is more in male. Respiratory diseases like tuberculosis, it is also more in male. And 90% of the patients are there in COPD patients. Now, when I'm talking about infection, let us talk about the COVID also. You all know that the infections are happening. There are genes, there are sex hormones, and also there is a microbiome and immune response to that. And it is found that severe disease and higher mortality is in males, which I have already discussed. There are sex differences. So obviously we are studying now in the modern medicine biomarkers. There are more than 600 biomarkers and more than 1000 trials which are going on to identify biomarkers. And it has been found that these biomarkers which are related to male are very easily showing that why male is suffering more from infections, and especially now COVID also. In the COVID, the gender is playing important role, and immune system, and also cytokine storm, which we are talking about. It is more in male, and it is more severely causing inflammatory diseases and small vessel thromboembolism phenomena, and affecting even kidney and other organs also. Brain, kidney, all the organs, the lungs, all are affected, and that is all more in male. So what's the sex has to do? We should understand host response, immune response to the coronavirus is different. And also there is the mechanism and biomarker which will have bigger role in identifying the susceptibility in future. And therefore the effect of COVID on sexual function and fertility is also studied in the initial reports, and it has been found that it affects the sex organs. It has systemic effects because of the inflammatory and thromboembolic phenomena, and also it is affecting the mental health, which is also already at a casualty in the male. And social deprivations are there, social backwardness there in relation to the mental health. That is also men is backward, and therefore it is affecting everything in male. And there is a problem in the testes. There is significant seminiferous tubular lesions in male. Reduced Leydig cells are there. Mild lymphocytic inflammation is there. Actually, the lymphocytic infiltration is there, and that is affecting the sex organs also. And the semen containing the COVID virus is not identified as the transmission source, which can be otherwise suspected. So all the functions in the intestines are affected, and also the endocrine functions are also affected. There are other effects like hyperthermia, which will affect the sexual function, secondary infections, hypoxia, which is detrimental, and also systemic cytokine release and steroids and other medications when given. That will also affect the male sex organs and other mortality and morbidity and immune responses. So it has been found also when we talk about sex that Indian men have the least sex in the study conducted. It is the Men's Health Survey, which was conducted in 2013, and the severity of erectile dysfunction significantly correlate with the metabolic syndrome. And lower IIEF5 values in the patients with the metabolic syndrome, and also fasting blood sugar, triglyceride, and WC are also significantly affecting the IIEF scores. And lower testosterone levels are there, and these all cause the sexual dysfunction or associated with that. There is potential consequences of testosterone deficiency, and this is called the mid-life crisis also, or andropause, equivalent to menopause and Adam, and so many names are there. There is poorer quality of life in male osteoporosis is there, sexual function, libido, ED is affected, and prevalence of metabolic syndrome is there, which cause depression, cognitive impairment, irritability, and memory losses, and comorbidities, and affecting longevity. There is a high prevalence of testosterone deficiency in aging Asian population. It was the study was done by the Malaysian urology president, that is Kim Hu Tan, and it was demonstrated that testosterone replacement therapy, when actually testosterone is low, otherwise it is controversial, it is beneficial to the symptomatic patients and improve the metabolic health, general health, sexual function, mortality, and longevity. Testosterone deficiency is definite entity in Asian male. It is more than other reasons, and there is a high prevalence, and it is therefore associated with multiple comorbidity, which we have already discussed. Potential consequences are poorer quality of life. You will see the depressed faces of male. Male osteoporosis is there. The central obesity is there. Sexual functions are affected, especially libido and erectile dysfunction. And therefore, the penis is called the barometer of men's health, because erectile dysfunction will is the window or is the mirror of other systems, maybe cardiac, maybe your central nervous system. Diabetes is diagnosed after erectile dysfunction. Dyslipidemia is diagnosed after erectile dysfunction. So in the questionnaire, when the patient is interacting with you, sexual health or related direct, indirect question should always be included in our questionnaire, whether we are in the prostate clinic, whether we are in the hypertension clinic, whether we are in cardiac clinic or in endocrine clinic. Everywhere this erectile dysfunction is important, and questionnaire should direct towards that. And there is urgent and pressing need for screening and further research on ED. And when in the different studies, it was studied that to how many, in the last column of the cartoon, you see that in different studies, so many parameters were studied, like ED, LUTS, diabetes, and in some study. And it was found ultimately that ED, premature ejaculation, anejaculation, LUTS, PADAM, or other parameters, when they were correlated, they were all, one thing was there, you see is going to everything: physical disability, diabetes, hypertension, CVD, metabolic syndrome, obesity, chronic inflammations, acromegaly, severe hyperprolactinemia, hyperthyroidism, COPD, and psychological feature. So ED is very important. We should never forget, and it is called the barometer of health, and also it is also called the sentinel marker for our health, and it has been included in the guidelines for cardiac health also, and it is the marker for endothelial dysfunction, which is associated with ED. Endothelial dysfunction is parallel to ED, erectile dysfunction, and it is also an early pathophysiological step in the pathogenesis of advanced atherosclerosis and is predictive of future cardiovascular events and even the stroke events. The brain stroke occurs, the ED occurs 10 years before, and the cardiac event before occurring, ED occurs 2 years before that. So this is important to study, and treatment with the angiotensin 2 type 1 receptor antagonist reduces endothelial dysfunction in the corpus cavernosum while reducing atherosclerosis. So this is important thing to note, and in our treatment protocols also this is to be included. We change the medications, we change the hypertensives, we change many drugs which may lead to ED, and which we are commonly giving for statins, we are giving antihypertensive, we are giving. We should know that which antihypertensive is to be given and how it is to be replaced. So these are important things, and ED also occur due to oxidative stress in the tissues, and especially corpus cavernosum. When it is there is the relative ischemia, it is causing the erectile dysfunction and endothelial dysfunction, and it appears strongly linked to the microalbuminuria. It is weakly associated with other predictors of the coronary atherosclerosis, such as low APO and A phenotypes. Central nervous system has been suggested to be the pathways of afferent pain signals from myocardium and in central mechanism of erectile dysfunction, especially in hypogonadism, that is testosterone deficiency. Temporal association is there in ED and CAD, and it is sentinel for the heart, especially. And also, ED is predictor of CAD. I have told 2 years before it happens, and therefore CT angiography is recommended if in the patient who is around 40-45 years who comes with ED unexplained, then we can find coronary blockage in coronary angiography. And CT coronary angiography has been included in the guidelines. And this is the Princeton Consensus Panel 3 guidelines, which I'm mentioning, and this is important, and we should go for stress testing and other investigations if ED is there and no cardiac symptoms are there, even then. And in Indian scenario, I have told you that it is rampant, and triple vessel disease is also rampant in ED patients. And also there is onset of symptoms precede the symptoms of CAD by approximately, I told you, 2 years, which is given in literature. And Indian studies, it is 2.5 years, 24.6 months, sorry, in 84% of the patients. So it is a clear early warning. Mortality is also more. Those who have ED, if untreated, if the basic cause or causative pathology is not addressed, there is more mortality in male. And when we are talking about the morbidity and more mortality in males compared to females, this is important. When ED is there, you address to that. And also there is men with ED have 26% of higher risk of all-cause mortality and 43% higher risk of death due to CVD compared to men without ED. ED is definitely therefore a risk factor, and risk factor for ED, when we summarize, our age, diabetes, hyperlipidemia, lower urinary tract symptoms, hypertension, psychological stress, and low physical activity, lack of exercise. That's why we stress on lifestyle. Moderate to severe ED, but note the mild ED were associated with increased risk of CVA within the next 10 years. That is, I told you, stroke or cerebrovascular accidents. So there is strong and independent association between ED and CAD, and also with the diabetes, and 8-fold higher in patients with those without silent myocardial ischemia. Why should we screen for ED? I have already discussed. It is in uncomplicated type 2 diabetic patients. Sometimes they are uncovered and they suffer from sometimes silent myocardial ischemia also. That's why it is integrated health. It is not the only purview of a urologist, the cardiologist, endocrinologist, everybody is coming back, and that is why we are calling the men's health as the integrated specialty. And therefore, I have, I think, enough stress on various studies are there. ED becomes significantly worse after a cardiovascular event. You know that cavernosal arteries are the smallest diameter. Next is the heart. So 2 years before we will get the symptoms in penis, and next bigger are the your brain arteries, and therefore they are suffering after almost 10 years when the blockage of cavernosal arteries start. And therefore almost 30% of the patients with proved CAD, they do not complain of ED, and age may be an explanation. ED and CD share common risk factors, and which we have already discussed, and should be screened all the people, and also association with CDs of various disease entities I have already discussed. And metabolic syndrome, when we come, it is not only hypertension, it is not only CVD, not only diabetes, it is insulin resistance also. There are various factors. There are environmental, and also your genotypes, and therefore there is a positive energy balance should be there in environment, and thrifty genotypes, phenotypes, and all details which are given. And it is the part, this table is from your Campbell. And adipose tissue hyperplasia occurs after that imbalance, and altered free fatty acid metabolism is there, or there is a release of adipokines, and this leads to various pathways which lead to metabolic syndrome. So this is the basis of metabolic syndrome, and they are all the factors are interrelated. In the there is a association in dyslipidemia, hypertension, endothelial dysfunction, hypercoagulable states, which becomes important now in COVID also. Dietary factor, that is why we say that patients with the higher morbidity, they should be taken care, because they have more of the hypercoagulable state, which is also the result of inflammatory response to cytokine storm also. And therefore impact of metabolic syndrome is on urology. I told you that with this these phenomena, all the organs are affected. There is a renal insufficiency, stone formation is more. You know that males are forming 3 times more stones than females. RCC, even renal cell carcinoma, prostate cancer, bladder cancer, all are more in male. And also the overactive bladder is more in male. LUTS is earlier it is actually different overactive bladder. When the global studies were recently conducted for approval of mirabegron and other blockers, it was found that when we studied the Indian subcontinent, and we concentrated, we included in the inclusion criteria the LUTS patients also, who are having the overactive bladder symptoms. So they were there. It was found that in some of the centers, the recruitment was more of males than females, against the popular belief. So this is very important. At least in the population, they are more and more diagnosed now. LUTS is absolutely for males, and prostate cancer and low testosterone and ED. So male is affected mostly, and these are the urological afflictions, and therefore the urologist has to lead the team, and therefore when there are 5 factors in metabolic syndrome, The one is abdominal obesity on the left side of the cartoon. Then from top to bottom, it is vasoconstriction, endothelial dysfunction. The pancreas is affected, muscles are affected, and glucose metabolism is affected, insulin resistance is there. And then because of the liver also getting involved, there is a problem, and there is triglycerides and high density lipoproteins are they are decreased. So these are the reasons for metabolic syndrome. Various clinical parameters therefore have been correlated, and their ranges are given. The waist circumference, what should be the fasting glucose, that should be not be more than 100. It is metabolic syndrome. 150 triglycerides should not be more than 150. Cholesterol levels are there, blood pressure 130/85, and others. And therefore, as I have just mentioned, that you have to see that any three of the five factors which I have just explained, they will lead to metabolic syndrome diagnosis. And therefore, diabetes mellitus, these are some studies which are proving. They are done in India also. There are famous Subito did study which has the same results which has given about insulin resistance also. The studies have been done, the mechanism have been studied, and the endothelium has been blamed for that, and insulin resistance was measured by homeostatic model assessment also, which is HOMA model. And ED may be the first clinical sign of endothelial dysfunction. Endothelial dysfunction, everywhere we are reading that it is because of endothelial dysfunction. This is also because of endothelial. And what is happening? The first clinical sign, ED. And that is what I am emphasizing again and again. And that is the men's health. That is the men's health of last 1 millennium. That is the men's health of present millennium. And that is the men's health of the future millennium. And therefore, we should be very, very careful that we should understand all the components of metabolic syndrome and also the related erectile dysfunction. So I'll now not elaborate more than this on these components. And we have already discussed about the depression, and depression, especially in the COVID era, you have seen that mental health is mostly talked about, and in the telecounseling and other components when we are discussing in the COVID wards, in the patients, in the ICUs, the male is suffering more, and the after effects are there, and there are permanent effects are also coming of the depression, and consequences in the males, they are more than females. And therefore, we should know that after adjusting for obesity, monthly income, urbanization level, and comorbidity, the patient's metabolic syndrome, they are 3.2-fold higher hazard ratio for male ED diagnosed than the controls. Now, about, see, in various slides you are seeing that erectile dysfunction, hypogonadism, premature ejaculation, they are all interrelatedly presented and ultimately leading to physical problems and psychological health problems. And there is a strong correlation between sexual dysfunction and all these metabolic syndrome components, and ultimately quality of life and depression, mental health, which is very important. And therefore, coming to again the various trials, I have already told you that the various trials have been done. And coming to now a word about LUTS, everybody knows that it is a common knowledge that erectile dysfunction and lower urinary tract symptoms, they are correlated. If you treat LUTS, the ED also gets improved. And some of the medicines have come, PD5 inhibitors, especially tadalafil in low dose, 2.5 or 5 milligram. It is benefiting the both. And some people, they are advocating that even for the coronary health also, the low dose of tadalafil is useful, and ultimately this is also like low dose aspirins are given. Similarly, the low dose PD5 inhibitors are also given. And therefore, this is important to understand that LUTS treatment will lead to improvement in the erectile dysfunction. Increase of LUTS will lead to more of erectile dysfunction. And these inhibitors I have discussed, tamsulosin and ED, tamsulosin capsules show a significant statistical improvement in ED. And therefore, we think that these drugs are affecting our sexual life adversely, but it may be related to premature, this unejaculation and other problems. But overall, the erectile dysfunction, the tumescence and other components, they improve with the treatment of LUTS with the even tamsulosin. And there are certain new drugs have come, avanafil and all PD5 inhibitors. I'll not go into that in detail. Melanocortin activators, which are being studied, and they are being added to the treatment of erectile dysfunction. Gene therapy for both fertility and also erectile dysfunction, that is also coming now. And also stem cell therapy introducing new adult stem cell into the damaged tissue in order to treat disease or injury. There is a vast scope of this therapy in sterility and importance. A number of stem cell therapies exist, but most are an experimental stage, costly or controversial. There are certain stem cell therapies which are not approved, but they are advertised. So we are looking for ideal ED therapy, and that is one is the management of the causes of ED also. And to summarize, erectile dysfunction is a predictor and associated with various common comorbidities. So it is a window of curability if we understand it properly, and it gives us better sex life, paradigm shift, and right from initiation, sexual and reward, and penile rehabilitation and disability is currently, sexual disability is not recognized as the disability category, and various protocols are there. Today we are talking about penile rehabilitation after radical prostatectomy, and all we understand it better, how to control it, how to manage it, and therefore urologist is leading in that also, and on perineal surgeries also. WHO European panel has been formed for gender. There are suggestions for research on various parameters, and also health seeking behavior of men is to be improved. They are to be more insured. The problem assessment is to be done. There is no organized data, no dedicated scientific body is there. Lack of literature and ignorance and neglect should be addressed. Lack of funds and allocation of the resources is very important, and our administration, our government should provide more funds for also the research is to be directed to unaddressed questions. There is poor allocation of resources. Less money is allocated, not only in India, but you see that breast cancer receive 60 million more than the prostate cancer, and ovarian cancer receive 64 million more than the testicular cancer. So it is all, funding is also biased funding in the Millennium Development Goal, which were declared by 2000. In there also, there is a very small chapter or paragraph written that on reproductive and male health, and therefore we should know that what is going on globally. There are awareness programs, there are the associations being created, there are programs which have been launched, like US agency launched Real Men Wear Gown campaign in 2008. National Institute of Mental Health has launched the campaign Real Men, Real Depression, and also Quebec Suicide Prevention Week refers young men to a suicide prevention hotline, and 33 suicide prevention centers have been created. This is in Canada. So therefore, we should understand that homogenization of society is important. We should understand, we say that housewife and male soldiers, but we should also understand there should be transformation and also mixing of the role of all, if they have to live at the same lifespan, and there should be we can say house husbands and women soldiers, because everybody has to take every role. Some traditionally male traits are there which may actually provoke the men to seek psychological help. You must have seen that at home also, if some difficult job is to be done, then the parents say that the boy will do and the daughter will keep away from that. So these are all the socio-cultural issues also, and this has to be improved, and a lot of unanswered questions are there, that who should practice men's health, how we will integrate it, how should broader non-gender specific health issues and risk behaviors are to be managed, what should be men's health center offer. If you create a men's health center, or your clinic, if your urological clinic, you identify some hours for men's health, what should be the equipment, what should be the how you are going to start it. And this is important question which may be addressed in your theory exam also. And what can we do about it? Particular time of vulnerability, I told you, is teenage and midlife crisis, and we have to break the Hardonian image. And need of the attitude changes there. When male think that I can do it all of my own, I don't depend on anybody, I don't need anybody, but the attitude should change. Choice is ours. The attitude should be, I can't depend on others in society to take care of myself, and therefore I need to be more insured. I need to go to the doctor. I need to follow the prescription of the doctor, and the attitude is to be changed, and we have to make the choice. So we have created Men's Health Society also. Urology Society of India is having the combined programs with that, and this was established in 2010. And also World Medical Association, our Dr. Ketan Desai, who is also a urologist, the keynote address he had given as president of World Medical Association, or the keynote was on men's health only. So this is so latest which is going on. Past was that men is stronger sex, present is men is more susceptible, and future is that you identify problems, accept, screen, prevent, integrate, and specialize. And therefore, it has been now adopted. It is everything is happening very fast. It has been now adopted by Indian Medical Association. You can see Professor N.P. Gupta, Justice Dave, the president of Indian Medical Association, and other important office bearers launching the project Men's Health by Indian Medical Association also. There are training modules which have been formulated. They are module 1 at lower level, at physician MBBS level. Men's health specialists are there, like orthopedician taking interest in men's health and others. And then module 3 is for the advanced men's health. That person or that center will be dedicated to men's health. And India, almost 8 to 10 centers are already functioning for advanced men's health. And it is to empower. We have various aspects of men's health. We have formed 8 modules, and which are now being launched already. And this is module on prostate health. So prostate health is not the prerogative of only urology. It is men's health issue. Sexual dysfunction, second. Cancer, diabetes, hypertension, cardiac health, obesity, metabolic syndrome, and mental health issues. These are the integrated approach, and these are the audiovisual aids which we are preparing and propagating. And men's health specialist is expert is sitting at the center, and all 32 specialties are surrounding him. And you may say that the module 1 trained men's health expert is at the center. He will refer to the concerned specialty, super specialty, and the patient will come back to him because he has to integrate with all the other specialties also. And there should be close knit units. And who can be men's health expert? Actually, urologists, 70 to 80% in the world, they are leading the men's health clinics. And the clinic should offer the health-friendly advice, screening, disease prevention, management of male-specific and male-predominant conditions, management of sexual issues also, and information, education, and communication devices, and health checkups. And lifestyle disorders and sexual disorders are to be addressed. And also there should be registration in the clinic, then evaluation, then referral of the person, and then follow-up. And our Campbell now in 12th edition mentions that it should include clinical management of male patient. It is not sexual health. Male patient clinical management overall. It should include adaptation of patient-centered home model and electronically medical records, scrutiny of the testing and outcomes, dovetailing and with patient satisfaction metrics. And therefore, engage in the form of sexual health, evaluate completely using the protocols, and you should use the tools and explain the risk factors and spread the message. And we will need couple of room, license with the expert, license with the diagnostic, sample collection facility, basic things which can be there in any clinic. They can be developed. Glucose monitoring, ECG, Euroflow, and instruments, which can be developed in any of the clinic very easily and space. And we are running at Ram Manohar Lohia Hospital, the men's health clinic since 2001. So we have to ultimately do some IEC activities, tie up with the resident welfare associations also. And if we see the financial inputs and outputs and profitability, the clinician will add to their income also by doing these professional services also. And after 30 patients a month, a break-even point will come. And this is being done in a very famous men's health clinic, which was inaugurated last year in Patna. And also in Gurgaon, one men's health clinic is running. In Bombay, it is running, and various doctors who are leading it, they are coming forward. So therefore, future directions are plans to unite together to establish men's health as the integrated specialization, provide men's health friendly facilities, men's health experts and men's health focused clinics, and establish national men's health programs. And therefore, let's come together to deliver a continuum of care that men deserve. Let's all devise the men's health specialty as integrated specialization, and let the urologist lead it. So this is all I wanted to tell you today. And therefore, I think now there will be, this is this was not a thing where you have to do any case presentation or all, because so many things are involved in men's health. And therefore we will now discuss, and any questions in the chat box, or anybody can, any of the resident can ask for the questions which are coming to their mind. Thank you very much.
Dr. Ajib, there's no question in the chat box. I think your class was, I think, brought many amazing facts to the attention of the residents. I think, I don't know whether I should say an eye opener or ear opener. There were many statements which you have put from the evidence of literature, the ailments, the culprit being the Y chromosome. I think the residents will be surprised to note that how they would have thought differently, or they may not be aware of the various facts which we have presented.
Again, there are 3 to 6 time mutations, and there are only 50 genes. And these all genes are disease-carrying genes, and this is giving us a masculinity and
absolutely. And very interesting observation which Dr. Ajib brought is, after 100 million years or close to million years, this Y chromosome is going to become extinct, and the females there'll be females and females with little male characteristics or something like the attribute. So imagine that sort of scenario. But it was very amazing class, and probably what he brought to the attention of all the agents was that you should not consider that this is something a very narrow area of just related to ED and fertility or the sexual health. See the 8 modules he has brought for the development of this specialty. Not many residents should be aware how much contribution Dr. Rajiv has in this area of men health. He started from the small beginning, and now he has positioned himself as a global leader in the area of men health. He's playing a very pivotal role in nationally as well as internationally in the area of men health, and he has a good contribution in bringing this men health chapter in the our national society. The talk was amazing, the facts was amazing, and probably for the residents, what is important is those who are in final year, they can always think of keeping men health in their mind to develop as a what you can say area of interest. Not only it has a multidisciplinary approach with the urologist being a team leader, you have a cardiovascular or the endocrinologist and all that who will be your colleague, but it will give a something like a you can always make it a men wellness clinic, or what he was telling is dedicated to men's health. So that probably for practical point of view will be very good
So
for.
I'll compare it, Dr. Chawla, I'll compare it with the tumor boards, like
Yes,
multidisciplinary.
yes, yes,
It is
absolutely,
actually
absolutely.
tumor board, like it is a board, it is a
Yes,
multidisciplinary approach, and
yeah,
where a leader is urologist. If we
yes,
lose this
yes,
opportunity, somebody
yes,
else will grab it, and maybe tomorrow some cardiologists start doing that. It is our
yeah,
purview, endothelial dysfunction. So, but I have tried to showcase that
yes,
most of the problems are urology related,
yes,
whether
yes,
it
yes,
is LUTs, whether it is infertility, erectile dysfunction, endothelial dysfunction, kidney problems, cancer problems, and so it is very wide and
very
back
well.
into.
And very wisely said that it is always better to when you are finishing your residency, if you are going into practice, so this is the area you can always look upon. It is for practice point of view also good, and probably it will fetch more patients, because these are the patients
Not
who
only
will be
it will fetch more patients, Dr. Chavla, it will
uh,
retain your patients with you.
yes, yes,
And
yes, yes,
your
yes,
practice will flourish. And I told you that if you can see under that clinic 30 patients in a month, the break
yeah,
even will come, and it is written in even in your Campbell that it is professionally going to be very useful for all the urologists, and we should not lose this opportunity.
absolutely. And another important thing is you have to think it very seriously, because you never know, a few years down the line, you will have people from alternative medicines coming also and competing with us. And they will also try to have a bite from this area. And it's better to have,
Yes, you are
uh,
right. Like we are fighting with these Neem Hakims and all
absolutely,
people,
absolutely, correct, correct.
Dawakhana and all, we fought that, and all are coming. Immune boosters, we are telling that the role of immunity, and they all will come with so many new things which are floating. Your chemist shops are filled with the
Yes,
immune boosters
yes, yes.
nowadays.
But because you are studying urology as a science, you will be in better position to lead the group of your colleagues who are from endocrinology or cardiovascular or other specialty, and probably this will be worth exploring when you are finishing your residency and going into the practice. It's very important to keep the back of your mind. You should not get obsessed with just choosing endourology and uro-oncology and all that. This can be a part of your area of interest, and probably it will be very nice to have this as a armamentarium in your practice. And on behalf of Indian School of Urology USI, sir, it was an amazing lecture. Many thanks to you. I'll just, for the concluding remarks and vote of thanks, I'll just see whether Dr. Rajiv TP is on. Dr. Rajiv? Dr. Rajiv? So he is there actually logged in, but I think.
I am
So
here.
I think,
Yes, sir, sir. Sir, we are done, sir. Just I'll invite you to
I am
propose a vote
listening,
of
and I'm
thanks.
listening to the
Yeah.
lecture and your comments on it about starting a thing, somebody taking up this speciality.
Yes.
I think like enterology was something untouched upon in the field of urology once upon a time. Now enterology has become a very posh specialty, subspecialty, and many people are coming towards enterology. And in fact, many people are taking up this practice also. In fact, regarding the men's health, I know one Dr. Reddy, who is a urologist in Hyderabad. He's already running a full-fledged men's health clinic. Dr. Professor Sood will be knowing, and he is one of the Indian urologists, one of the, I think one more, who is running a full-fledged men's health clinic. So as has been highlighted in the talk, this is totally an ignored thing. People think men are great, men is the front runner in anything. And as Sood has highlighted, we should overexert ourselves to build up six packs and other things. It is it's a wrong notion, actually, I should say. Yes, we should have good exercise, moderate exercise, not over. Otherwise, during our teens, we are burning out ourselves. So that you have seen many bodybuilders, when they come into the 40s, they become very flabby, fatty with a visceral pouch and other things. So this is what happens when you give away. And so that is why like you should have a continuous moderate activity throughout our life to improve your aging and keep yourself free from various health hazards which men are facing, as has been highlighted by Professor Su. If you take the list, men tops in everything, even if it is a malignant condition, even if it is a non-malignant condition, men are in the forefront if you compare to the thing, and as highlighted in
even
various.
infections and corona.
Yeah, this is, they say, because of the SRY and other things, and because of the thing, males are more thing to get affected or afflicted by corona. And what the Indian statistics also says the same. If you take into account the number of female patients to male patients, I think it will be in 1:10 ratio, even in India, if you take into account. And this is a fact which has been ignored, and we think we are the supreme and we march forward, but ultimately we have to face off all the brunt of all the metabolic disorders and other things. So it was an interesting talk which I was listening, and Professor Sood has given a overview on everything, and this is an eye opener to many of, even we also have come to know some of the statistics from him, what exactly and where we are at this point of time in men's health. So thank you very much, sir, for giving a good overview. And I hope this will be an eye opener. And why we have incorporated this is the men's health is already there, has been highlighted in the 11th and 12th edition of the Campbell. But I don't think any institution which is running MCH or DNB program has ever talked or ever given a lecture to the resident on men's health. And very likely in the
topic for recent advances, in fact.
Yeah.
These are the new additions.
New additions, and if it's very likely we'll have a theory question somewhere the other time, so to highlight on the various. So thank you very much, sir, for your enlightening talk and deliberation. And
thank you.
I thank Arun Chawla also for being and interacting with you, and it was very interesting. And I hope those who have participated have got an overview, and in the days to come, one of you will take up this subject, and it is a quite upcoming thing, and many Western countries are also running the men's health clinic very sincerely. So thank you very much again. And
Thank you, sir. Thank you.
Thank you.
Good night, everyone.
Thank
Thank
you,
you
sir.
very much.
Good night, sir. Good night, sir. Bye, sir. Bye, sir.
Good night. Good night.
Thank you.
Thank you, Navneet, Kiran, for your unstinting logistic support behind the screen. Thank you very much.
Thank you, sir.
Thank you. Good night.
Thank you. Good night.